All right, we are back. This is Senate Health and Welfare. It's still January 8th. And we're going to go through reports with our ledge councils. So for the record, go ahead.
Great. For the record, Jen Carvey, Office of Legislative Counsel. Katie McLean, Office of Legislative Counsel. All right. And so we have, and if you don't currently have this on your website, you will. We have a list of all the reports due to this committee. So we called it late 2025 and early 2026, although there's a few that are earlier in 2025, and we have some future ones that go out beyond 2026, just for us to keep track of them and for you to remember some of the things or to learn about some of the things that the legislature has asked for. So if there is if it's in blue and underlined, then it's a live link, which means we have the report usually on the legislature's website. Occasionally it's posted somewhere else, but I've included the link here so you can easily access. So the first report that is on here is an expenditure analysis from the Vermont Care Board covering years 2021 and 2022. This is a little bit historical at this point, but they had taken a pause on the expenditure analysis, which is supposed to be a more frequent requirement. And they kind of, I think, overhauled their methodology and approach. And so now they're going back and doing these reports for some of the years they missed. So this is the 2021 and 2022. The report itself is dated March 28th, but it's posted on our website as having been received, I think, sometime in June or July. And so this is it analyzes the expenditures on healthcare, both for Vermont residents and for services delivered by Vermont providers. So it gives you a really good sense of what kind of healthcare activity is happening that affects Vermonters and Vermont providers. Next is one of the reports from Act 68 that we talked about this morning. So this is the one-time report that was due on July 1st from the Agency of Human Services on the hospital spending reductions that they had approved as of that date.
Next, there are quarterly reports regarding the Burlington Overdose Prevention Center. So the status of those grants using the opioid abatement special fund money. So in the July report, the City Council had approved the center. They're working on insurance coverage. So you'll see these quarterly updates throughout this presentation.
On our website now, just wanted to post to go.
Okay, thank you. It's there.
Next is a report from Dale on the progress report on developmental services payment reform. This is the design of developmental services payment reform model for potential implementation in October, and then the final report was due in September. So this was sort of an update prior to that final decision. And it went to joint fiscal.
Right. A lot of these reports that came in over the summer and fall were due to committees that meet when the legislature is not in session, but when they were on topics that were relevant to this committee, or in some cases, they have future reports that come to this committee. We've included. Next, we have the Vermont State Health Improvement Plan, which may be of particular interest to the chair. This is an existing report requirement that we've talked about in the past. It's technically required of the Agency of Human Services, but it usually comes from the Department of Health. And it sets forth the health goals and values for Vermont. And this one, I wasn't specifically expecting it at any particular time, but I was pleased to see it show up on the website. And it looks like it covers the period 2025 to 2030. So it may be of interest to you to see what they've identified.
Next is a monthly report on general assistance emergency housing. These reports are sort of covering the same topics. We've had monthly reports for a couple of years now, so you'll see these monthly reports coming in throughout the presentation.
Next, and this is our first one that doesn't have a live link. This is was supposed to be quarterly choices for care report. So these are services provided to individuals who need or could use a long-term care setting level of care, but are able to receive services in the community. And this is utilization and expenditures are what's supposed to be covered. I did flag this for someone from the Department of Disabilities, Aging and Independent Living yesterday, that why I couldn't find any of these reports on our website, so they might need to resubmit. Next, we have the first of the monthly reports from Act 68 on an update on the outcome measures for healthcare transformation that the agency identified. I'm used to using our voices this much. Oh, I'm used to roll.
Okay,
Oh,
there we go.
talking all morning, we just did it upstairs as well. So this is the first of the monthly reports. You'll see this show up many times as well, on outcome measures for healthcare transformation. And I'll just note them and not talk more about them when we see them.
So, you know, as we're going through, I'll say it now, but I was gonna save it for the end, but there are significant number of these monthly reports, and then there are quarterly reports, and then there are annual reports. There's a lot of reporting. And the folks who are doing it are very busy reporting. Sometimes it might be better to have them doing other things. So there may be some of the monthly or quarterlies that could be eliminated.
I still saw the report on the deaths in hospice coming through again. That was my assigned report to report on when Claire Air was chair.
I know.
And I don't know why we need a report on deaths in hospice.
Well, so we'll.
It's a report on deaths in various settings and use of hospice prior to death. That had been a particular priority of the Human Services Committee for a long time. I don't know if they still want that report, but it does measure the use of hospice services.
If we had, well, now if we had here, you have to go to Colchester and find a hospice.
This is people receiving hospice services that
it's
can
at
be in
home.
home as well as in, and they do break it down by where the deaths occurred and including whether it was at a hospice.
So my suggestion was to look at the reports that you have concerns about. And identify, perhaps we'll take some time to identify some of those, whether they're quarterly, monthly, annual, biannual, whatever it is. And then we'll ask the reporting entity how it fits with their work, and we'll think about how it fits with our work, and maybe we can make a recommendation down the hall to GovOps.
We used to get, and maybe we
think
can
you
share
will.
GovOps.
They'll probably do
Every
it.
I think
year,
they're doing it.
Yeah.
Yeah, they'll do it.
Every year or
years
so.
they send us a list and,
Right,
I think sometimes
I've
it's had trouble getting out of the
yeah,
yeah.
GovOps committee. But even if they don't, we can still,
Yeah.
prepare repeals of reports you don't want to receive anymore.
whatever it is.
And I'm sure you'll make some of your friends in the executive branch very happy if you revisit and repeal reports you don't want to receive anymore.
Okay,
All
all right.
And next, general assistance emergency housing, a monthly report in August.
And we have the September report on the outcome measures for healthcare transformation, as well as a quarterly report on Medicaid program enrollment and expenditures. Followed by receipts, expenditures, and balances in the Health Information Technology Fund. An annual report.
Another monthly report on general assistance in September, and then a report on changes to the administration of supplemental nutrition assistance programs, SNAP. There is language in statute that there needs to be a report from our DCF 90 days after any substantive changes at the federal level in SNAP law. So that's what this report is. And it covers some of the changes like cost sharing of administrative costs for SNAP and work requirements.
Next, we have the Green Mountain Care Board annual bill back report. Under statute, the Green Mountain Care Board can bill back to the regulated entities for a portion of the costs of regulating them. So this is health insurers, hospitals, and I guess that's it at this point. It had been accountable care organizations, that is last year was removed. And so they report annually on expenses that they could have billed back and what they did actually bill back. Next, we have an annual report we have not received from the Department of Disabilities, Aging and Independent Living, again around choices for care. This one is the calculation and allocation of savings. And they're supposed to report annually on the difference between what was appropriated to them and what they actually spent in the Choices for Care program. less a 1% reserve to avoid having a waiting list for the high needs group in the future. And then for that identified difference between the appropriated amount and the expenditures, make a recommendation on reinvestment of those funds, and there are certain parameters for what they use them for.
And Choices for Care is a state program.
Choices for Care is a state program. It's now part of our 1115 waiver from the federal government that allows us to get Medicaid coverage for services that might not otherwise be matchable, including long-term care services provided in home and community settings.
People who are stuck at home because of illness or fragility.
Right. This is really avoiding nursing home level. People
Yeah.
who can avoid nursing home
More
level care by
expensive care.
receiving services at home or in the community, which is often where they prefer to receive them if they can.
Earlier, we looked at the progress report for the developmental services payment reform. This is the final report that came in September to the Joint Fiscal Committee. And we have a report at the end of September for general assistance emergency housing. And then an evaluation of early childhood workforce programs. This was required in 2021 and evaluates the effectiveness of a scholarship for early childhood workforce providers and also a student loan program for individuals entering the field of early childhood education. After that, there's a progress report on child protection registry reform, child abuse and neglect substantiation recommendations. And I believe that Human Services will be hearing about that report tomorrow.
Next, we have the October reports. The next two are on implementing and achieving hospital spending reductions from Act 68 and the update on outcome measures for healthcare transformation.
Thank you.
Next, we have the next quarterly report on the Burlington Overdose Prevention Center.
And I noted for Katie when I was pulling in the links for these, the dates required for these overdose prevention center updates are very different from when they're submitting them. So it was a little, we sort of had to make a judgment call. So there was one that came in, they were supposed to be July and October, and they came in May and August and nothing after that. So I don't know. So we'll put the August one with the July date and don't have anything to show for the October date. Next, we have the annual list of global commitment investments. These are uses of federal matching funds that were allowed under our global commitment section 1115 demonstration program to use that we would not otherwise in the absence of that demonstration. And so this is a list of all of those authorized investments and how the money, what the expenditures were in those programs. Yes, and then we have the
hospice.
2023 report, deaths and hospice care report. It's a pretty short report, but it does give some information about numbers of deaths in various settings in Vermont and the extent to which people were receiving hospice services during the 90-day period preceding that.
These reports that are right here.
Yeah, there are 13 pages of reports.
This is why I'm asking, but let's remember, put this in context. We put a lot of work out in our laws and we want to know what happened.
Yeah,
So, we gotta have oversight, but some of this goes on for a period of time where it's no longer needed.
Who could prioritize this list?
We do.
This
We do.
committee loves reports.
Yeah.
More than any other.
There are some, I don't know, we Act 68, we need to have those reports come. We need some of these things coming back, but I'm also one of those who thinks maybe we can limit some of them. And I know the administration would be happy to work with us.
And we did try to note for you when they're annual or monthly, and then the ones that don't say that are one time. So there may be somewhere you're hearing
Yeah.
one time
Yeah.
about something, and others that are ongoing that maybe ones you don't need to receive.
I think the Department of Health needs to monitor that. But I don't know that we do unless there's something that we should.
Put
know
that on your
about.
list, Senator.
Trace that is good.
All right, next up, we have the pharmacy best practices and cost control program report. This is the annual report on the Medicaid prescription drug cost containment efforts and prescription drug programs.
At the end of October, you received the General Assistance Emergency Housing Monthly Report.
Then November 1st, you had the two Act 68 reports around hospital spending reductions and outcome measures for transformation. Next is one you did not, I could not find. I didn't see it for the previous year either. This is coming out of the 2023 legally protected healthcare bill or act around gender affirming care and reproductive care and some protections for providers and patients. And you had asked the Office of Professional Regulation and the Board of Medical Practice to report back on Vermont's participation in interstate compacts and how that, whether there were any challenges related to our legally protected healthcare activity laws, particularly around the Interstate Nurse Licensure Compact and the Interstate Medical Licensure Compact.
That was a one time.
That was one time, but it's not switch.
So
Yes, I'm sorry. When I said previous year, there's another one coming up later that's an ongoing.
okay.
In 23, you required a plan for elevating the status of early education in the Agency of Education. So this plan would be to achieve greater parity for early childhood education with K through 12 education in terms of roles, decision-making authority, and their reporting structure. After that, implementation plan for they did provide,
Yeah.
right. An implementation plan for reorganizing PCF to increase responsiveness to elevate the status of childcare and early education services. So similar topic.
Yes, and so those two are put under from whom it says submitted jointly with AHS, submitted jointly with AOE. It's one report where they address both and they worked, it looks like they worked on it together. We didn't have it. So next up is recommendations for re-envisioning the Agency of Human Services. This was based on longtime efforts by former Senator Kitchell to look at the scope of the Agency of Human Services and whether it should be split into two agencies or otherwise reorganized. The result of the legislation was to direct the agency to take a look at itself and come up with recommendations. I will give you the spoiler that they did not recommend splitting themselves up, but they did propose some potential changes or sort of revising focus going.
I think
For critique.
yeah, so we won't do that, but I will just say one thing. Right now, what that agency does not need is to be put into greater stress.
From what
Yeah, they're already.
Well, she was first secretary of AHS, I believe.
Oh, yes. She
Yeah,
went from the inside out.
Yeah,
Yes.
And she said it should be held at Human Services, that it was too much.
She suggested splitting it to an agency of healthcare administration and an agency of human services. That's not how it came out of the legislature, and it was not the recommendation that came back from the agency. Next is a report from the Department of Financial Regulation based on Act 68. We talked about this a little bit in our overview this morning. Looking at domestic health insurer sustainability. Again, that's Blue Cross Blue Shield of Vermont and their solvency issues and proposing a plan to ensure their sustainability going forward. And then,
I'm sorry.
that's okay. And then we have choices for care, quarterly report, again, not posted.
Next is the State Housing and Residential Services Planning Committee. They were to create a plan for creating permanent, affordable, and service-supported housing for Vermonters who participate in developmental disability services. Some pieces of this report include a schedule for creating an additional 600 units of service-supported housing and addressing the funding needs for providing this type of housing.
That's Act 69. Yeah.
Okay, next is an annual report from the Agency of Education on after-school and summer learning program grants. What was this me also? Okay. Annual report of the Child Fatality Review Team. This team looks at providing systemic recommendations by looking at unexpected child fatalities and patterns and lessons learned that could inform the community of providers. Oh, and next is also me. November report on general assistance emergency housing.
The next one came from last year's budget bill, was directing the Green Mountain Care Board to report on the distribution of settlement funds from a settlement it entered into with the University of Vermont Medical Center, particularly those related to primary care providers who are not affiliated with the University of Vermont Health Network. There was not a date specified. There was some discussion about this topic at one of the Health Reform Oversight Committee meetings.
Yes.
But there's not been anything we've received that I'm aware of from the board. So it might be something you just want to ask about.
It was difficult, I think, to put the date on because it's really the University of Vermont Network, $11 million that they are giving out. And we were interested in having them connect with the Agency of Human Services and others to understand where the dollars might be needed.
Yes, I think there was
we
some-
can't direct them.
Some plan for, right, some plan for how it was to be distributed. I think there were some mechanical issues with literally and practically how to get the money from the university to the providers. That was part of the issue. So it's actually.
Sure, I don't have highlighted. Review of Medicaid payment model for residential substance use disorder treatment. That's a one-time report, due in December, required by last year's Act 3.
Another report from Act 68. This is a one-time report as well. This is from the Department of Vermont Health Access, and we're directed to look at the capabilities. We talked about this as well of accountable care organizations that were funded in whole or in part with state dollars, and see if there were some that could be preserved going forward, particularly those around comprehensive payment reform and other approaches. Then we have a one-time update on hospital transformation incentive grant awards. And you talked about this morning, there's $2 million to the Agency of Human Services to provide grants to give hospitals an incentive to participate in transformation activities. And the agency was to report by December 1st on monies that were obligated or expended as of November 15th. Then we have the December 1st reports on hospital spending reductions and transformation outcome measures. And the quarterly report on Medicaid program enrollment and expenditures.
You get an annual report from the Child, Youth and Family Advocate. I remember seeing that they were asking for an extension on this, so I think that was approved that they will.
Yeah.
The report will be forthcoming.
Next is an annual report from the Office of the Attorney General on prescription drug cost transparency. This relates to some efforts from a number of years ago on looking at drugs for which the cost has increased significantly over a fairly short period of time, and directing the Office of the Attorney General to talk to manufacturers about why. There have been some limitations on their ability to access the information. So I think the report has turned into something fairly general that is similar from year to year. Next, we have, as a result of some 2024 legislation, a one-time report from the Emergency Medical Services Advisory Committee with an inventory and assessment of emergency medical services that are available in Vermont.
That's a one-time,
That was one time and has been submitted.
right? And that,
It's
yeah,
part of some additional work that they are doing that you'll see coming up.
that also went down the hall to GovOps, I think,
Yes.
right?
Yep, yeah, it was largely handled in the GovOps committee,
Right.
but we included the health.
A little bit of both.
Also, from the Emergency Medical Services Advisory Committee, although I do not know if you are going to receive this year or not, because this was also revised as a result of the 2024 legislation. You've asked them for an update on their statewide plan for coordinated delivery of emergency medical services in Vermont. They're supposed to talk about their progress toward meeting the goals identified in a 5-year plan that I don't think they've had an opportunity to develop yet, and their goals for the coming year. So you may receive some abbreviated form of that, but they may still be working on the larger statewide.
The next is a report that you heard yesterday, the assessment on recovery residences. There was an inventory that was conducted about what recovery residences exist in the state and the current capacity to collect data. So that you are already familiar with. The next two reports were required by the same bill from last year. It was a bill actually became kind of a Christmas tree bill because your Medicaid payment reform was in it. And the public inebriate language was in it also.
right.
But this had the Human Services Board language. House Human Services started with the bill last year on the Human Services Board. In the process of working on it, they realized they had a lot of questions that they needed answered before they could really dive into that work. So what they required are two reports, one from the Agency of Human Services and one from the Human Services Board, to answer a whole variety of questions that will inform what they anticipated to be working on this year. So the report from AHS is going to look at attorney training for attorneys presenting before the board. Also recommendations for legislative action. The Human Services Board report is going to provide proposals to improve understanding of the board proceedings and process for lay people. Also a process for exchanging periodic feedback among practitioners in front of the board. And also whether there are any opportunities for a person raising a concern before the board to present a personal narrative.
Jenny, for our one true newbie, a Christmas tree
Oh,
is a bill.
Oh,
I am the best decorator here. Miscellaneous tax, it has a broad range of germaneness, and other things tend to
tacked on to it.
get tacked
Yeah.
onto it. Miscellaneous tax is very broad, and anything that has to do with revenue that doesn't
Fit somewhere else.
well,
Yeah.
it's decorated.
Yeah, that's kind of what I figured.
Yeah.
thank you.
It doesn't happen very often in other committees, but in my.
And I do think either one or both of these Human Services Board reports has just been submitted and posted on the legislative website, but we haven't had a chance to update. I think it was posted this morning, so I haven't had a chance to update with the links in, which we will. Next we have from last year's budget bill. So I was not involved with the language, but I wanted to flag it for you that there is a report required, was a report required that has been submitted from DEVA on nursing home extraordinary financial relief and looking at reducing the need for an amount of extraordinary financial relief that nursing homes are asking for. Which I think is pretty significant in recent years. Also from last year's budget bill, there were $10 million in Medicaid provider stabilization grant funds appropriated. And so DEVA was asked to report on the grants that they've distributed and some information about the recipients, what the outcomes have been or expected outcomes are of those grants, and any recommendations for further stabilization of those providers.
In December, you received the General Assistance Emergency Housing Monthly Report. There is also a requirement, there's an emergency service provider wellness commission. This was the commission that was created 5 years ago. And the concept behind it is that emergency service providers are often have traumatic experiences in their line of duty, and that commission is to look at how to provide wellness resources and mental health services to bolster that community. So they provide an annual report on their activities and any legislative recommendations. Similarly, you have an annual report from the Agency of Education and DCF on the evaluation of universal pre-K programming. Also an annual report from the Mental Health Crisis Commission. This commission is a little bit different. It looks at usually a single incident where law enforcement and mental health crisis workers are responding to a particular incident, and they'll evaluate how that incident was handled for the purpose of making more systemic changes and recommendations to how future incidents are handled by those two groups. Next, in 2023, there was a request from the Department of Labor to provide data on Vermont wages for early care and education providers. This looks at what the current minimum wage levels are based on Vermont and other state data for this particular group of providers. And after that is the next iteration of the quarterly report on the Overdose Prevention Center.
Also, the January 1st, Act 68 reports on hospital spending reductions and transformation outcome measures.
Next is an annual report from the Substance Misuse Prevention Oversight and Advisory Council.
Also, the annual report from the Office of Healthcare Advocate. We should have asked him where it was, because I don't have it as a line link. Just because he was.
Yeah.
Next is a report, at least quarterly, to be posted on the Attorney General's office website. When there is notice of introduction of new high-cost prescription drugs, the requirement that the Attorney General's office be notified by the manufacturers when they're getting ready to introduce a new high cost, which is defined in the statute, prescription drug. And so I posted the most recent link that was available. It's kind of hard to find on the Attorney General's website, but they have a link from the April to June 2025, that quarter. So that's the link that I prepared.
So what I'm gonna suggest is that we draw a line right here
Okay.
and call it a wrap for the day. And we will come back to looking at these reports. My suggestion to all of us on the committee is to go through the reports. As I said before, there are some that we're going to find really critically important, others we're going to question. So maybe check off the ones, I don't know which way you want to do it. And when we come back to it, we'll go through all the reports and see what you think. And then Jen and Katie will elaborate a little bit on what each one is. I don't know that we can go through 12 pages.
That's what I read 12 pages of reports.
No, it's a lot. It is a lot. Interestingly, some of the reports are put in during the budget process, so they end up in appropriations, or another committee will put it in. It has a reference to us, and we have to decide how worthwhile is it, either for oversight